Hello everyone, welcome back to Dental 101. My name is Albin and today we are going to be talking about OSCEs. The topic of today in regards to OSCEs is how we're going to introduce the conversation of OSCEs in each and every cluster. Um, Starting the OSCEs is one of the biggest factors according to me, because you need to make your first impression across the examiner. So if you're gonna have a bad start to your OSCEs, it actually also leaves a bad impression, and throughout your OSCEs there's gonna be a lot of issues. So to make it very easy and understandable to all of you, it's quite simple. Your cluster is divided into three parts, so 1, 2 and 3. First is the information gathering, second is the diagnosis and management, and third is the treatment planning. So according to the cluster, your dialogues should be divided into first, second and third part, which means basically in your first cluster, which is information gathering, that's your dialogue 1, which is basically your patient coming to you inside your clinic for the very first time, and they're coming to you with the concern, and you need to just listen to them, gather information and try to understand and come to a provisional diagnosis. So that's the dialogue 1 of your cluster 1, which is information gathering. In cluster 2, which is your diagnosis and management, you would see that in your question already, you might have already spoken to the patient, you might have done some investigation and have come to some conclusion. So you need to make sure that you start your OSCEs from there and not from the top. Okay, so that's dialogue 2. And your third dialogue is the treatment planning, which is basically you have done all the investigation, you have come to a conclusion, and you probably are in midst of a treatment and want to tell something to the patient. So that would be your dialogue 3. Okay, so I'm just going to start again. The dialogue 1, which is clinical information gathering. Consider a patient, Mrs. Wilson's have come to you with a complaint of some wobbly teeth. So it's the first time that she's coming to you, you haven't done anything. Probably you might have a clinical picture or an x-ray, but you're going to start the conversation. So how are you going to start and introduce yourself? You're going to first introduce yourself by your name. Okay, so it would be either good morning or good afternoon, depending upon what time you're asking. So good morning, Mrs. Wilson, thank you for seeing me today. My name is Dr. Albin and I'll be looking after you today. So what brings you in here? And start with an open-ended question. So when you start with an open-ended question, that also gives a chance for the patient to actually express themselves and tell a lot about their concerns. It's a good way to also gather a lot of information. So you should also have a structure at the back of the head that this is what I wanted, and whatever information she might not be giving, that's when you have to ask more questions after that. Okay, so maybe she might be in a lot of agony, or she might have some kind of past traumatic experience or something at all, and you need to just respond with an empathy by saying, I'm so sorry to hear that you're going through such a pain and agony. I understand that probably you might be in a lot of stress about the situation. Well, I am here and I'm going to help you throughout this procedure. Rest and be assured that probably at the end of the discussion we will come to a solution. Okay, but before moving on, is it okay if I can quickly ask you a few questions? So that's basically your cluster 1, which is information gathering, and you then take it from there, asking a lot of questions of whatever you want to know. Now your dialogue 2 again is your diagnosis and management cluster. So in this cluster, usually you must have already done your introduction, you must have given you've done some investigation probably, and probably come to some kind of provisional diagnosis. So in your dialogue 2, which is your cluster 2, you don't need to introduce yourself again, like, hi, my name is Albin, how can I help you? That is not the right way to start. You should start rather in this way. Thank you so much for being so patient, Mrs. Wilson. While I was examining you, you remember we did some investigation around your gum areas. We also did a couple of x-rays, and I just wanted to discuss a few things about those results. Would it be okay if I can just carry forward? Or if you want to just add a few more questions here, would it be okay if I can just ask you a few questions before we move on? So that's dialogue 2. Remember not to introduce yourself there. And then dialogue 3, of course, is cluster 3, which is treatment planning and management. Usually in these cases, you have done all things, you have done investigation, you're probably into your final diagnosis, or you might be in the midst of a procedure. For example, you have done an extraction and you've broken the crown of the teeth. So you need to just explain to the patient about what are you gonna do next. So you're never gonna introduce yourself again saying, hi, my name is Dr. Albin, I'll be taking care of your teeth again. No, that's the wrong way. So you have to probably start in between. So you must say, thank you so much, Mrs. Wilson, for being so patient while I was extracting your teeth. I'm so sorry, I just want to share something with you, and we'll take it forward from there. For example, you might be extracting, you must have heard a crack while I was taking the tooth out. Fortunately, we got the crown of the tooth out, but there's a little bit of root which is left, and I just want to go through that procedure before moving on. Is it okay if we can discuss this together? So basically that's the three parts. So just imagine yourself being in kind of a screenplay or a play where you got dialogue 1 where you introduce and know the patient, dialogue 2 where you might be probably needing some investigation to further carry on your diagnosis, and dialogue 3 where you already came to a diagnosis and you just explain the procedure to the patient. Okay. The next question again just in this video is how much time should we require for each and every cluster to spend in history taking, information gathering, and the diagnosis part. Okay, so in information gathering, I usually tell history taking is the most important part, so spend as much time as you can, almost about 7 to 8 minutes. And then leave the rest of the minutes, like 2 to 3 minutes for your provisional diagnosis or maybe your investigation, and maybe you want to just chart up the treatment plan for the patient. Okay. In diagnosis cluster, usually I say spend about 5 to 6 or a little bit more time on the history taking. Of course, there would be a lot of history information on the screen for you, but whatever is left, you need to touch base on that and re-clarify those information on the TV back again. And the rest of the 4 to 5 minutes, spend a lot of time in your differential diagnosis, your different type of investigation and why you're doing it, interrelate that to your investigation and everything and so forth. Okay, and in your treatment planning, of course, you don't need to spend a lot of time on the history taking, because you can probably explain to the patient the procedure. It is probably just 3 to 4 minutes touching base on all the relevant history which is already on the screen, and maybe asking few questions which is important, and then spending the rest of the 6 to 7 minutes on treatment planning, explaining the procedure, the advantages and the disadvantage, financial consents, review, recall, and all of those things. Okay, I hope this video is beneficial for you. Keep watching Dental 101. Thank you.